Good morning. This morning we've got Dr. Kris Parchuri from Spine and Orthopedic Specialist, and we've got Trevor Bridges from Sky Fitness. We're going to be talking about exercising without injury. And I seriously have a ton of friends that do CrossFit. My pastor, he keeps trying to get me to do it, and it seems like everyone's getting hurt. Why is that?
Well, from the medical side, unfortunately, a lot of times people jump into exercise routines without properly working their way up, and they don't use a lot of proper form, and they realize as they get older, their musculoskeletal system, bones, soft tissues, etc., are prone to injury. So the main reason people get injured, unfortunately, is that they just don't work their way up to an exercise regimen that is appropriate for them.
Huh. So injuries from working out, like, are you saying CrossFit, it could be any type of working out?
Well, let me let Trevor kind of tell you what CrossFit's about, and then I can tell you more about some injuries that I see.
Okay, cool. What's that, Trevor?
So CrossFit is a whole bunch of different exercises kind of compiled into this one program that is able to offer people just a lot of variety, basically. And like Kris was saying, you got to make sure you warm up the right way, otherwise there are repercussions for, not taking care of yourself at the get-go.
Okay. So can you give us some tips on how to exercise to avoid injury? I think this would be Dr. Parchuri's answer.
Sure. I think the main thing you have to understand is that with any exercise regimen, you have to properly warm up. So CrossFit is a system of workouts that's meant for those individuals that have a high level of tolerance. And you cannot simply just go into CrossFit because you're a weekend warrior and think, I'm going to start this weekend. You have to work your way up into it. And I think remembering that and humbling yourself and understanding that will allow you to avoid injury. Most of the injuries I see are from individuals trying to push themselves too extensively, and they use improper form, and thus they injure their shoulder or their low back or their ankle, etc.
Oh, okay. So what do you suggest? So you just say right from the get-go, just take it easy?
No, I think, and I'll speak for myself, and Trevor can punch in here, is that you have to start with what your body can tolerate. You have to understand your limits and then just work your way up sequentially. CrossFit is the goal. It's not it's not the baseline. If you want to work yourself up to a CrossFit program, you have to start by just getting in the gym regularly and making sure you build your way up into doing it. But that's just not for CrossFit. It's for anybody that starts a workout routine. You just have to start at the base with the basics and then get acclimated.
Okay. Well, how does this pain, how can it affect your life?
A lot of times people, don't understand that pain is multifactorial. Yes, it can be due to the fact that you injured yourself in some capacity, but in other times, pain affects all aspects of your life. It's psychological, it's emotional, it's physical, and you have to understand exactly the source of the pain so you can adequately treat it.
I completely agree with you on that statement. That is so true. How can we tell when the pain is justified?
Well, a lot of times, pain is significant when you have numbness or tingling in the lower extremities or the upper extremities, so the arms or legs. Other times, it can be significant when it hasn't improved with things such as rest, with anti-inflammatories, or just stretching. And if it's present for anything, usually longer than a few weeks, I would recommend you go and see a physician to have it looked at.
I hurt myself not too long ago playing softball, and I'm not kidding you, my hip, I thought I broke my whole body, but my hip was the main pain. But then I didn't go to the doctor, and it finally went away a couple of weeks later. Is there any specific warning signs besides what you said that will let you know that it is more serious of a, like the smaller injury of just being sore?
Sure. As I mentioned, that you want to make sure that the symptoms or the pain itself starts to improve. If it doesn't improve over the several weeks when the onset has started, that's concerning. If you have symptoms of numbness or tingling, weakness in the extremities, that's concerning. And obviously, before you go to a physician, you want to try simple things such as anti-inflammatories, rest, ice, because they're going to recommend that first anyway.
Mm-hmm. Totally. How can you help people out there that are in pain and can't go on with their daily life?
Well, I think we, myself included, specifically, are very good at diagnosing the source of one's pain. And I think that's the key to establishing a good treatment protocol and helping someone get back to their normal life. So if patients want to get a hold of me, they can by visiting my website, sostulsa.com, or calling me at 539-664-4448.
Okay, I understand you also do pro bono work for the Tulsa County Medical Society, helping those in need each month. Tell me all about that.
Sure. So the Tulsa County Medical Society, or TCMS, has a program where those patients that cannot afford surgery and in need of surgery are presented to individuals that are willing to donate their time and their talents. I'm one of those on an extensive list, and so we work with TCMS on a regular basis to take care of patients that are unable to afford care on their own.
Now, Trevor, this is my question for you. Where are you? Which CrossFit are you at?
I'm at CrossFit Sky at 101st and Sheridan.
CrossFit Sky, 101st and Sheridan. Now, Dr. Parchuri, is that where you go to CrossFit, or do you actually teach a class?
Well, to be honest with you, I'm one of those weekend warriors that has been utilizing a personal trainer to hopefully work my way up into a CrossFit routine, so I don't injure myself. I'm hopefully going to get there soon.
Setting a good example.
Yeah. Well, I mean, I've seen Trevor work these guys out before, and I don't want to hurt myself and then be a walking example of don't do this in CrossFit.
Yeah, Sky is a pretty awesome gym. I used to work out there. And then I moved, and so I'm in trying to save money so I can get back into Sky or maybe even a CrossFit. How can people get a hold of you, Dr. Parchuri? I know you give us your website and your phone number and all that good stuff again.
Sure, it's sostulsa.com, or my phone number is area code 539, which is the new local area code, 664-4448.
Okay, and you guys are at 91st and Yale?
We're off 91st Street in between Harvard and Yale, yes.
Okay, very cool. And then we got Trevor. You are the CrossFit coach, the CrossFit king, down at Sky. Is that the one you said off by Promenade Mall?
Actually, it's one at 101st and Sheridan.
101st and Sheridan. Okay, so you could go see Dr. Parchuri and then go to CrossFit.
There you go.
They're not far from each other. Well, I appreciate both of you guys' time. I mean, I've done CrossFit once, and I respect the people that do CrossFit. It is pretty incredible. And if you are listening out there, don't be stupid and think you're a little weekend warrior like Dr. Parchuri said not to be, right?
That sounds good.
All right. Thank you, guys.
Thank you.